37 million Americans have chronic kidney disease right now. 9 out of 10 of them do not know it. That statistic comes directly from the National Kidney Foundation, and it should terrify you. Because the kidneys are not like the liver. They do not regenerate damaged tissue. They do not grow back. Once you lose kidney function past a certain threshold, you do not get it back. And the reason 90% of people with kidney disease have no idea is that the kidneys will lose 50, 60, even 70% of their filtering capacity before you feel a single symptom that sends you to a doctor. But your body is not completely silent about it. There are signs, quiet ones, early ones, signs that show up in places you would never think to connect to your kidneys. And if you recognize them now, while your kidneys still have functional reserve left, you can intervene with something so simple, so inexpensive, so well studied in randomized controlled trials, that it borders on absurd that your doctor has never mentioned it. It costs less than $2. It is sitting in your kitchen right now. And a landmark clinical trial of 740 patients, published in the Journal of the American Society of Nephrology, demonstrated that it reduced creatinine doubling by more than 60% and significantly delayed progression to dialysis. I have been practicing internal medicine for 15 years. I have watched patients arrive at my office with creatinine levels that told me their kidneys were already in serious trouble. Patients who had been feeling fine until they suddenly were not. Patients who had missed every early warning because nobody taught them what to look for. Today I'm going to teach you what to look for, and then I am going to show you what the research says you can do about it. Subscribe to Dr. Kevin Miles and hit like. There is a lot more coming and you do not want to miss it. First, you need to understand what your kidneys are actually doing every second of every day, because most people dramatically underestimate how much these two organs control. Your kidneys are not simply filters. That description is technically accurate, but functionally incomplete. Each kidney contains approximately 1 million microscopic filtering units called nephrons. Each nephron is a tiny, sophisticated processing plant that filters blood, reclaims what your body needs, and excretes what it does not. Together, your kidneys filter your entire blood volume roughly 30 times per day. That is approximately 150 liters of blood processed every 24 hours. From that volume, they produce about 1 to 2 liters of urine containing the waste products, excess electrolytes, and metabolic acids that would poison you if they accumulated. But filtering is only the beginning. Your kidneys regulate blood pressure through the renin-angiotensin system, a hormonal cascade that controls how tightly your blood vessels constrict and how much sodium and water your body retains. They produce erythropoietin, the hormone that tells your bone marrow to make red blood cells. They activate vitamin D into its functional form, which is essential for calcium absorption and bone health. They maintain the precise acid-base balance of your blood, keeping pH in the narrow range that your enzymes and cellular machinery require to function. When kidneys begin to fail, none of these processes shuts off abruptly. They degrade, slowly, incrementally, and the body compensates for as long as it can, masking the decline until compensation is no longer possible. That is why the symptoms are subtle. That is why they get missed. That is why you need to know what they look like before they become obvious. The first thing I want you to check is your toilet bowl. Specifically, what happens after you urinate. You urinate. You glance down before you flush. And you notice something unusual. Foam. Not the occasional bubble that everyone produces from time to time. Persistent, layered foam that looks like the head on a beer or the froth you see when you scramble eggs. Multiple flushes and it still clings to the surface. Most people ignore this completely. They attribute it to the force of the stream, to the angle, to something they drank. But persistent foamy urine is one of the earliest visible signs that your kidneys are leaking protein. What is actually happening inside your kidneys when this occurs? Your nephrons contain a filtering membrane called the glomerular basement membrane. Think of it as a molecular sieve with holes precisely sized to let water and small waste molecules through while retaining large proteins, especially albumin, which is the most abundant protein in your blood. Albumin is essential. It maintains the osmotic pressure that keeps fluid inside your blood vessels rather than leaking into your tissues. When the nephron is damaged, those pores in the filtering membrane widen. Albumin begins slipping through into the urine. This condition is called proteinuria. And albumin in the urine does exactly what albumin does when you crack an egg into a hot pan. It foams. The protein molecules trap air at the surface of the liquid and create a stable froth that does not pop easily. This is why foamy urine is clinically significant. It is not a harmless curiosity. It is a visible sign that the structural integrity of your kidney filters has been compromised. It can appear years before creatinine rises to abnormal levels on a blood test. Years before your doctor would flag anything on a routine panel. If you see persistent foam in your toilet, ask for a test called a urine albumin to creatinine ratio. It is a simple urine test. It quantifies exactly how much protein your kidneys are leaking. Do not wait for your annual physical. Do not wait for symptoms to get worse. That test is the earliest standard screening tool available for kidney damage, and it costs almost nothing. The second sign connects to the first one directly, and most people never realize they are related. You wake up and your face looks puffy. Your eyelids feel heavy and slightly swollen. Your fingers are stiff and your ring feels tight. By afternoon, the puffiness in your face has resolved, but now your ankles are swollen and the elastic of your socks is leaving deep indentations in your skin. This migrating pattern of swelling, face and hands in the morning, legs and ankles by evening, is characteristic of fluid retention driven by kidney dysfunction. The physiology is straightforward. When kidneys are working properly, they tightly regulate sodium and water balance. Excess sodium is excreted. Excess water follows. The volume of fluid in your bloodstream stays within a controlled range. When kidney function declines, sodium excretion becomes less efficient. Sodium accumulates in the blood, and water follows sodium. Your total fluid volume rises. The extra fluid seeps out of your blood vessels into the loose connective tissue around your eyes and in your hands while you sleep, because you are horizontal and gravity distributes it evenly. When you stand up and begin your day, gravity pulls that fluid downward into your lower legs and ankles. The second component is the albumin loss we discussed with sign 1. When your kidneys leak albumin into the urine, the protein concentration in your blood drops. Albumin is what holds fluid inside your blood vessels through osmotic pressure. Less albumin means less holding force. Fluid escapes into the surrounding tissue more easily. The swelling worsens. Many people attribute morning puffiness to a bad night of sleep or eating something salty for dinner. And sometimes that is the explanation. But if the pattern persists, if it happens 3 or more mornings a week regardless of what you ate, if your socks are consistently leaving grooves by evening, the kidneys are the first organ I investigate. The third sign is the one that gets misdiagnosed more than any other, because it looks exactly like a dozen other things. You are sleeping 7 or 8 hours. You are not staying up late. You are not running a deficit. And yet you wake up feeling heavy, drained, and depleted in a way that coffee barely touches. By mid-afternoon, you are struggling to focus. Your thinking feels slow. Your body feels like it is working harder than it should to do ordinary things. There are 2 mechanisms behind kidney-related fatigue, and both of them operate silently for years before anyone connects them to the kidneys. The first is anemia. Your kidneys produce erythropoietin, the hormone that signals your bone marrow to manufacture red blood cells. As kidney function declines, erythropoietin production drops. Fewer red blood cells are produced. Fewer red blood cells means less oxygen delivery to every tissue in your body. Your muscles get less oxygen. Your brain gets less oxygen. Everything feels harder. Everything feels heavier. This is not laziness. This is not aging. This is your oxygen transport system running at reduced capacity because the factory that makes the production signal is failing. The second mechanism is uremic toxin accumulation. As your kidneys lose their filtering capacity, metabolic waste products that should be excreted in urine begin accumulating in your blood. These waste products, collectively called uremic toxins, interfere with cellular function throughout the body. They impair mitochondrial energy production. They disrupt neurotransmitter signaling. They create a persistent, whole-body sensation of fatigue that does not respond to rest because the problem is not insufficient rest. The problem is that your blood contains substances that should not be there. If you are experiencing fatigue that does not improve with adequate sleep, that has no clear explanation, that has been gradually worsening over months, ask your doctor for a basic metabolic panel that includes creatinine and blood urea nitrogen, and a complete blood count to check your hemoglobin. These are standard, inexpensive blood tests. They will tell you if your kidneys are quietly failing and if your red blood cell count has dropped. 3 signs: persistent foamy urine, morning swelling that migrates downward throughout the day, and an exhaustion that sleep cannot resolve. Now the intervention. Here is what most people do not understand about chronic kidney disease. In a significant proportion of CKD patients, the kidneys are not only losing their ability to filter waste, they are losing their ability to excrete acid. Your body produces acid constantly. Every metabolic process, every protein you digest, every cell that produces energy generates acid as a byproduct. Healthy kidneys excrete that acid and simultaneously produce bicarbonate, a base, to neutralize the acid remaining in the blood. This is how your blood pH stays in the narrow range of 7.35 to 7.45 that your cells require. When kidneys weaken, acid excretion drops, bicarbonate production falls. Your blood gradually becomes more acidic. This condition is called metabolic acidosis. And here is the critical finding. Metabolic acidosis is not just a consequence of kidney disease. It is an accelerator of it. The acid itself damages the remaining nephrons. It creates a vicious cycle. Weaker kidneys produce less bicarbonate. Blood becomes more acidic. The acid damages the kidneys further. The kidneys become even weaker, and the cycle accelerates. The intervention that breaks this cycle is sodium bicarbonate, baking soda, the same box sitting in your kitchen cabinet. The landmark study is called the UBI trial. 740 patients with chronic kidney disease stages 3 through 5 were randomized into two groups. One group received oral sodium bicarbonate daily to correct their metabolic acidosis. The other group received standard care with no bicarbonate supplementation. After 36 months of follow-up, the results were striking. Creatinine doubling, the primary endpoint indicating significant kidney function loss, occurred in 17% of the standard care group versus only 6.6% of the sodium bicarbonate group. That is a greater than 60% relative reduction in the rate of kidney deterioration. The bicarbonate group also showed significantly delayed need for dialysis and reduced all-cause mortality. A systematic review and meta-analysis combining data from multiple clinical trials confirmed the finding. Sodium bicarbonate retarded the decline in kidney function compared to placebo or standard care. The 2024 KDIGO Clinical Practice Guidelines for Chronic Kidney Disease now formally recommend oral sodium bicarbonate supplementation for treating metabolic acidosis in CKD patients. The cellular mechanism is straightforward. When you consume sodium bicarbonate, it enters your bloodstream and directly raises your serum bicarbonate level. This neutralizes the excess acid that is damaging your remaining nephrons. The tubular cells of the kidney, which are the cells most vulnerable to acid injury, are protected. The inflammatory cascade triggered by acidosis is interrupted. The rate of further nephron loss slows. Additionally, metabolic acidosis drives muscle wasting. Acid stimulates the breakdown of muscle protein through the ubiquitin proteasome pathway. When acid levels are corrected, muscle breakdown decreases. This is why many CKD patients on bicarbonate supplementation report improved energy and reduced fatigue. Their muscles are no longer being consumed as a buffer against chronic acidosis. I need to be precise about the practical details here because this is a medical intervention, not a kitchen experiment. First and most important, do not self-prescribe sodium bicarbonate for kidney disease without consulting your physician. I am telling you what the research shows so you can have an informed conversation with your doctor. You need a baseline serum bicarbonate level measured through a blood test. If your level is below 22 millimoles per liter, you are in the range where supplementation is guideline recommended and clinically beneficial. The dose used in the clinical trials was approximately 1 millimole per kilogram of body weight per day. For an average-sized adult, that translates roughly to 1/4 to 1/2 teaspoon of baking soda dissolved in water taken daily. Your physician will determine the exact dose based on your lab values and will monitor your serum bicarbonate to ensure it stays in the target range. Take it on an empty stomach in the morning, dissolved completely in a full glass of water. Do not take it with meals because it neutralizes stomach acid needed for digestion. Wait at least 30 minutes before eating. If you are on blood pressure medication, this is critical. Sodium bicarbonate contains sodium. It can elevate blood pressure in some patients. Your physician must monitor your blood pressure and may need to adjust your medications. This is not a reason to avoid the intervention. It is a reason to do it under medical supervision. Within 6 to 8 weeks, if your metabolic acidosis is being corrected, you will typically see a stabilization in creatinine levels. In some patients, creatinine may modestly decrease as the acid-mediated damage to the nephrons is reduced and the remaining kidney tissue functions more efficiently without the burden of chronic acidosis. A few additional clinical notes. Sodium bicarbonate is not appropriate for patients with uncontrolled heart failure, severe hypertension, or significant fluid overload. In these conditions, the sodium load can be harmful. Your physician will evaluate whether you are a candidate. For patients who cannot tolerate sodium bicarbonate due to its sodium content, sodium-free alkali alternatives exist, including potassium citrate and calcium citrate, that provide the same acid-neutralizing benefit without the sodium. Ask your nephrologist. One more thing that is within your control immediately and requires no prescription: dietary acid load. The foods you eat determine how much acid your kidneys have to excrete. Animal protein, particularly red meat, is one of the highest dietary sources of metabolic acid. Processed foods, cheese, and grains are also significant contributors. Fruits and vegetables, conversely, are alkaline forming. They reduce the acid load on the kidneys. Research has shown that increasing fruit and vegetable consumption in CKD patients produces a measurable reduction in metabolic acidosis, comparable in some studies to oral bicarbonate supplementation. This does not mean you eliminate protein. Protein is essential, but shifting the ratio, more plant-based foods, more vegetables, moderate rather than excessive animal protein, directly reduces the acid burden on your kidneys and slows the cycle of acid-mediated damage. Here is what I want you to walk away with: foam in your toilet, puffiness that migrates from your face to your ankles, fatigue that sleep cannot touch. Those are your kidneys asking for attention before they stop being able to ask. A major driver of kidney disease progression is metabolic acidosis, the buildup of acid in the blood that damages remaining kidney tissue in a self-accelerating cycle. Sodium bicarbonate, common baking soda, corrects metabolic acidosis and has been shown in the UBI trial of 740 patients to reduce creatinine doubling by more than 60% and significantly delay progression to dialysis. The 2024 KDIGO guidelines now formally recommend it for CKD patients with low serum bicarbonate levels. The protocol requires physician supervision. Get your serum bicarbonate measured. If it is below 22 millimoles per liter, ask your doctor about oral sodium bicarbonate supplementation. Simultaneously reduce your dietary acid load by increasing fruit and vegetable intake and moderating animal protein consumption. A box of baking soda costs less than $2. A serum bicarbonate blood test is part of a standard metabolic panel. The research is published. The guidelines are updated. The only thing missing is the conversation between you and your doctor. Your kidneys are not going to ask you for help. They will quietly fail until the damage crosses a line you cannot step back from. The signs I showed you today are the closest thing to a warning you will ever get. Now you know how to read them, and now you know what to do. A box of baking soda and a conversation with your doctor. That is the starting point. Everything after that is biology doing what it does when you stop poisoning it with its own acid. Subscribe to Dr. Kevin Miles and hit like. There is a lot more coming.